Are fellowships looking for people that are, really just well-rounded generalists, or are they looking more for residents that have, maybe can talk more on their subspecialization within the residency program and how they've sought out those additional cases or extra experiences?
It's a fascinating question. So I think it kind of depends on the culture and the place you're going. I know a lot of friends in the trauma fellowship business, and I've talked to a bunch of them about those things. And what they want is very similar to what I want, which is a teachable spirit. I want the resident who's going to come in, especially the PG4s and 5s that come in going, I know how to do this case, then the teacher doesn't appear. And sometimes my PA is going, why don't you just tell them what we'd already be done if you were involved? I'm like, they think they can do it. Let's let them swim. As opposed to the chiefs, I've had one chief specifically look at me and said, I am going to be on my own after my fellowship. Show me how you would do it. I was like, wow, okay. And so I think it's that teachable spirit as you come into fellowship, regardless of what you've done ahead of time, of saying how, show me what can I learn here as opposed to look what I've already done and all that. I remember when I started my fellowship, I came home one day and my wife looked at me and she says, what's wrong? And I said, I realized that specifically the injury we were talking about, everything I learned in my residency about that injury was wrong, that the guys at Vanderbilt have figured this out. Nothing against my residency training or that, but the guys at Nashville were so good at that. And if I had come in with a different attitude, they would have beat it into me, but it was a lot better to come with open hands going, please let me learn how y'all do it here.